Welcome, everyone. Hello, hello. Thank you for joining us today. We're going to hold on for a few seconds while our platform's letting everyone in. In the meantime, you're more than welcome to say hello, give a greeting in the chat, and let us know where you're tuning in from today. We would love to hear from you. Hello, hello. I see our numbers are growing, so our platform's letting everyone in. We will get started in just a minute here. All right, wonderful. Oh, it's so great to see everyone in the chat. Please let us know where you're tuning in from today. We always love seeing that and knowing who is out there with us. But hi, everyone. Thank you for joining us and welcome to today's webinar, Reducing the Risk of Youth Suicide, a discussion on education, prevention, and early intervention. My name is Jackie Zimmerman, and I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. I have just a few notes for you all before I introduce our panelists today. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you'd like to request a certificate of attendance, we'll have a form for you to request one of those. That link will be in your follow-up materials, and I'll also put that in the chat here shortly. If we have time today, we will allow questions from the audience. So please feel free to use the chat to ask questions throughout today's presentation, and also share any knowledge or comments you would like to in there as well. We want to recognize that this week is National Suicide Prevention Awareness Week, and we're very grateful at MHA for our panelists who will be speaking on this very important topic today. We want to provide those of you that are listening with a content warning. We will be discussing the topics of suicide, particularly youth suicide, suicidal ideation, self-harm, and other topics you might find distressing. We just really encourage you to take care of your mental health and disengage if needed throughout our discussion today. I'm very grateful to welcome our speakers for this afternoon, Dr. Shirey Turner, Colby Callan, Melanie Allais, and Barbara Barlow. We have these four amazing individuals with us. Dr. Turner is the Chief Health Officer at Crisis Text Line. Colby is the Project Director for the Thrive Project. Melanie is the Program Manager for Training and Outreach at Vibrant Emotional Health. And Barbara is the Executive Director at Mental Health America of Fredericksburg. So welcome, panelists. We're thrilled to have each of you with us today. You're all doing such important work within the field and addressing mental health and suicide prevention. I would just love to start by each of you giving a little background on yourselves and the work you do within your organization.
So hi, I'm Colby Coughlin. I work at the Northwest Portland Area Indian Health Board. I want to thank you all for allowing me to be here today. The Northwest Portland Area Indian Health Board is in Portland, Oregon, and we serve the 43 federally recognized tribes of Oregon, Washington, Idaho. And I want to just quickly do a land acknowledgement that would be really important in our area, and it's something that we actually were able to adapt from the Portland State University's Native American Student and Community Center, because we are just one block north of, or I'm sorry, one block south of their university. So the Northwest Portland Area Indian Health Board is located in the heart of downtown Portland, Oregon in Multnomah County. Today, we honor the indigenous people whose traditional and ancestral homelands we stand on, the Multnomah, Kathlamet, Clackamas, Tumwater, Watlala bands of the Chinook, the Tualatin Kalapuya, and many other indigenous nations of the Columbia River. It is important to acknowledge the ancestors of this place and to recognize that we are here because of their sacrifice, or of the sacrifices forced upon them. In remembering these communities, we honor their legacy, their lives, and their descendants. And what I get to do with help from our 43 tribes in Washington, Oregon, Idaho is do suicide prevention and that's the Thrive Project. It stands for Tribal Health, Reaching Out Involves Everyone. And I also work on tribal opioid response. And the health board, again, we're in Portland, Oregon, so we are, pretty close to many of the tribes and tribal areas that we serve. And thank you so much for having me today.
I'll go next. I'm Dr. Shayuri Turner. I'm an internist and pediatrician. I'm the Chief Health Officer for Crisis Text Line. I have a background in trauma and public health. Crisis Text Line is a national organization that provides free 24/7 crisis intervention and support solely on a text platform. We have trained more than 53,000 volunteers, all of whom are supervised by mental health professionals. And our service is by text in English and in Spanish.
Good afternoon, everyone. Thank you so much. I am honored to be among such amazing individuals here. My name is Melanie Ely. She, her, and they is okay are my pronouns. I am the program manager for training and outreach in our equity and belonging department here at Vibrant Emotional Health. One of the things that I do is I work very closely with the 988 Crisis Lifeline, formerly known as the National Suicide Prevention Lifeline, and making sure that when we are providing care to the nationwide individuals that contact us through phone, text, and chat, that they are receiving affirming and inclusive care for suicide prevention. Just a little brief mention of what 988 does. 988 is the national program that provides suicide and crisis response to all 50 states and territories. We have 208 plus call centers that answer phone, text, and chat in English and in Spanish, and we do provide ASL and interpretation services as needed. Thank you so much for having me, and I will pass it on to Barbara.
Barbara Barlow with Mental Health America of Fredericksburg. I want to say that's Fredericksburg, Virginia, not Texas or any of the other Fredericksburgs around the country. And we actually cover a region, not just Fredericksburg City. So numerous other counties surrounding the area. And since 1955, we've been identifying gaps in the delivery of behavioral health services and then creating unique local programs to meet those needs in the community. And we are a proud affiliate of Mental Health America, the national organization. And we pull down actually a lot of resources from the national organization that benefit our community directly. My pronouns are she, her, and I am so excited to participate in this discussion. And I'm going to learn what you guys are bringing to the table, although I do know a lot about what you guys do, but I'm glad to have a front row seat and join you. So thank you.
Absolutely. Welcome, everyone. And thank you to each of you incredible panelists for being here with us today. We are gearing our attention during this time together focused on youth, and right now is kind of our season where youth are going back to school, and so there's additional talk on how we can best support youth and their mental health. And so that's really what our discussion is focused around today, is reducing that risk of youth suicide in prevention, education, and early interventions, and what impacts those can have. So we're going to hop right into our discussion. And just for each of our panelists, what are your greatest concerns for youth mental health right now? Are there certain trends you're seeing in respected areas of work regarding youth mental health and specifically crisis?
Just really quickly, I think a lot of us are probably seeing similar things. But for, throughout our region, a few people have definitely talked to us. We did a needs assessment for youth at our annual Youth Thrive conference that is the last week in June every year, which this past June, we got to have in person for the first time in 2 years, which was super awesome. We did a needs assessment last year as well, virtually, and we actually saw an increase of stress, depression, anxiety. And I think we've all probably seen those things. We knew they were coming. The first part of COVID, people were happy to be at home and spending more time with their families. And being kind of shuttered in together, because we don't always get that. We're always in a rush, right? And then over time, that started to take a toll on people to not see extended family, to not do things with their friends, and so many other things. It's not just those couple of items, but many more. And so with that anxiety, and then obviously all of public health saying, please go reach out, see a provider. The access to providers is low. They're overbooked, they're overworked, and everybody is doing their absolute best. So it's really amazing when we see messaging that's like, you know what, if you don't want to talk to a provider yet, make sure you're talking to a trusted auntie, uncle, elder, traditional healer, other folks that absolutely have just as much experience. Maybe not academia experience necessarily, but they've been around their families, and for generations, people have gotten through a lot of stressful things, and so many other big item things that have happened throughout our country, and to Indigenous populations that have been able to bounce back and show that resiliency. So making sure people know that it's not just providers, but go to your aunties, go to your elders, go to your medicine people, and really just try to get assistance anywhere that they can. But that overbooking of what is considered a provider today, that's something that I'm stressed out about too. Is I want to see more providers, I want to see more availability. I also think it would be amazing to have more providers for specific populations as well. And that may help with our youth too.
I can add to that. Thanks, Colby. I think we're all here because we recognize that there's a youth mental health crisis that's taking epidemic proportions. It is deeply affecting our BIPOC communities and our BIPOC youth above and beyond their white counterparts. And the thing that concerns me the most is that we really don't have a good handle on why, right? There's so many factors. There's pandemic, there's racial trauma, there's the mass shootings, political unrest. I mean, we know sort of the list of things that are weighing on our children. Gen Z is the only, they are digital natives, so they have complete access to information at all times without necessarily the context, right? Sort of the more larger world and global context, but the information comes at them incessantly if they don't sort of curate it for themselves. For us, so that's the pediatrician, public health practitioner talking, as the chief health officer at Crisis Text Line, we know that based on the anonymized survey that our texters fill out at the end of a conversation, that over 70% of our texters are under the age of 24. So they are this Gen Z age, and they go, well below the age of 10. And we average 3,000 to 4,000 conversations per day. And what we've noticed between 20 and 21 and now into 2022 is that anxiety and stress are reaching an all-time high amongst the conversations that are being had, as are depression, sadness, relationships, and then the loneliness, the eating disorders, and grief were some of the fastest growing issues amongst our teen texters. And then, of course, the thoughts of suicide and feelings of isolation are tremendously high. And in the insights that we have and the data that we collect, we see those same topics, but at higher rates amongst our BIPOC youth. And that includes Black, Latinx, AAPI, and Indigenous texters, because we try to be as very specific and granular with our questions. And these are voluntary surveys that the texters fill out. So I just think that, looking at what's out there in the world that is facing our children, it can make them frightened. We've just got, and then if you layer that on trauma, so the intergenerational trauma that exists for children is so prevalent, and that includes abuse and neglect. So I think all of it, there's a compounding effect that we're seeing now post-pandemic.
Oh, Barbara, you're muted.
Unmute. I'll piggyback on that. And I forgot to share that Mental Health America Fredericksburg also has specifically suicide prevention education program. And specifically, we're working with youth in that program. So, and recently here locally, we had a community assessment done with our local hospital regional aspect, and our health district partnered to do that. And they identified mental health and access to care as the two greatest needs in our community. And that is just exacerbating what has been happening in our community. Even before the pandemic, we did not have enough mental health providers to meet the existing need, and it's only worse. And to the degree that here locally, and it mirrors what's happening nationally, I believe, of youth that have identified major depressive disorder, only 20% of those kids are receiving treatment for a myriad of reasons, but also lack of access to care. And additionally, we track national trends where the suicide rate overall across all the United States, all population groups, had been declining since 2019. But in that same time frame, the rates among youth have been increasing exponentially. So, and there's lots of different reasons for that, but particularly what's disconcerting for us here locally is that we've noticed with the lack of access to care, the increased rates of suicide ideation and actually death by suicide, the lack of access to care, the natural support systems due to the pandemic where people could notice risk factors being exhibited among the youth, those natural support systems have declined also. So there's less eyes on, say, the youth in general that could be somebody who would notice that their sleep patterns have changed. They're giving away their prized possessions. And that's coupled also with concerns about social media. So where you can have a persona of having good mental well-being, and that's not really your reality. And then additionally, the rates of use of social media has gone up dramatically. And that's the feedback that we're getting back from the schools and back from the kids, that it seems to track the more social media use, the more isolated and less belonging they feel. And that is disconcerting too, because, you need a whole community of people working together, partnering together in order to try and move the needle on some of this, which may be our new normal.
And just to add to all all these other like amazing thoughts as well, like that's what we're seeing as well, but also just to kind of also highlight that we also have children and youth who are members of the LGBTQIA plus communities and the trans and the non-binary experience that during the pandemic were cut off from their natural supports, who were not able to reach out to their chosen families, who did not have those outlets in school, and are still, coming up from those types of things, having to go back to school now, not having been around your supports, the loss of family members that were most likely their supports as well because of COVID and other COVID related illnesses. It is in our concern as well is, youth in general, but then those other subsets of youth that naturally are were vulnerable, who are now even more vulnerable because of lack of isolation, parasocial relationships on the internet. So it is a lot. It is a huge huge uphill battle, huge burden that we're seeing. And the trend is, how do we support them when they're going through so much?
And I'd only add one other thing, because the support system for these youth, their families, teachers, and administrators have all been taxed themselves and their own mental health by the pandemic and all things, around the isolation. So it's not even like it's just the youth who can lean into a more resilient support system. There's a fragmentation, just people being human, fatigue around what we've been through over the past 2.5 years.
Absolutely. Thank you all. Those were some great points around access or lack thereof, the necessary supports, those groups that are extra vulnerable, and just the changes in isolation and social supports that have happened for a lot of youth post-pandemic that just make it even more challenging for kids their age when it already is hard on their mental health. Next, what changes have you witnessed or maybe even have enacted as your organization that are focused on then better preventing youth suicide or supporting youth mental health to combat those challenges?
With the Thrive Project, we haven't really changed what we've been doing to combat these, but we've obviously seen and really helped our tribes and the tribal programs do more things online and have access virtually. So we have seen some of our tribes that have never done cultural activities virtually, that they started that during COVID, and they actually got to connect with some of their tribal members from across that had moved, like to the East Coast, or some of their tribal members that are now living in California. And so they had increased participation in some of the cultural activities that don't have to be done in person. Obviously, they would prefer, or all of us would prefer, but when virtual is an option, there was an increase in participation for the first part. I don't know if that continued throughout COVID, but definitely for the first big chunk of it. We've always worked with our tribal partners and then tribal organizations, the states, anybody that we really just connect with a lot that's in our region, to make sure that we're asking the tribes what would be helpful for their youth, and asking the youth. So it's not just us providing programming that we think is best, it's directly asking the partners in our tribes specifically and the youth. And also what has been done that's been rooted in culture. And that is most of the time what is working really well. And if an evidence-based prevention program has to be used, how can we supplement that with traditional activities? Often they're coupled together so that there is that connection to culture, that specific tribes and their traditions. But also if there's a funding issue and tribal best practices can't be used, or something like that, that evidence-based practice is used in connection with a cultural activity, a tribal best practice, or something that the tribe has been doing forever that has really worked out. And so we're just making sure to still continue to ask the community what works for them and ask the youth specifically, what additional assistance do you need? So if you don't want to always do fully in person, you want to do an event, but you want to have follow-up on a virtual community, then we're going to listen to that and we're going to try to make that happen in whatever way we can help with, whether that be monetarily, providing the Zoom platform, like whatever we need to do the best programming and give the best technical assistance to the tribes that we serve.
At Crisis Text Line, what we did, just in seeing the trends and also recognizing what a stressor it can be in returning to school, we created a mental health school supplies toolkit on our website, and I can provide that link at the end when we send out resources, but it's in English and Spanish, and it's for teachers, administrators, parents, and students to be able to print out, look up resources, really dive into the things that will help with mental health support. So it's everything from videos that can help with, stress. It's the development of a mental health plan, right? So how do you plan out your coping strategies when you're in a good space, or how do you work with your child to come up with a mental health support plan so they know who they can talk to and what are the things that help to calm them down so that when they are in a crisis, they can pull out the plan and sort of figure out what would be helpful. It also includes tips on how to discuss mental health between parents and students, parents and children, teachers and students. How do we normalize those conversations? And sometimes giving those resources and helping people along with, how do I say this? How do I ask about, a child that I think is in need of help? So these are things that are geared now and out and available on our website for students, but they're relevant year long, right? It's something that will be available for anyone who has a child or wants to support a child in crisis or in need. And when we have that in both English and Spanish.
Oh, Barbara, I think you're muted again.
I try and be polite and then mute it and then forget. Sorry. We've taken this opportunity to be thinking more disruptive terms as far as system practices. So whereas before we looked at our individual program, which is presenting an evidence-based program at local schools and partnering with them, we're kind of flipping that upside down and trying to collaborate across a broader segment of the community, pulling from that community needs assessment that was done. And for example, whereas we would just go into the school system, present the program, we now are presenting to staff and parents both to increase a sense of belonging and communication across the whole school so that it would encourage those natural conversations and remove stigmas. But we're so excited about this. We are also partnering with a mental health provider that works with youth and actually underserved communities. And they are going to be located in the school system itself. And so if there is a youth identified as exhibiting risk factors to suicide, then they can meet with a health provider. The school is going to coordinate with the parents, do the releases. All the medical information is protected under HIPAA with the mental health provider themselves. And we're coordinating that and getting the funding to try and make that happen. And that's never been done. I mean, it's probably been done somewhere in the United States, but not here locally. And the providers are not going to replicate anything that's in a IEP or 504 plan, which are mental health services for the students. It's the triage, it's getting the kids right when somebody has a concern. So hopefully they won't have a 504 plan, or that we can do a referral to another mental health provider. The parents are looped in and more aware. And so, and I like to think about optimistically, what are the opportunities that have been created because of the pandemic and the way that everything got turned upside down. And I'd like to report back, in our community at least, there is more of a spirit of collaboration and less of a sense of advancing just your own mission. And I hope that's something that stays with us.
I just wanted to say some of the initiatives that I'm hearing are like amazing. 988 is currently expanding. I mean, we just launched our new platform in July. So a lot of what we're doing is expanding and looking at how we can provide even more support, particularly around LGBTQIA youth, particularly around the Native communities, and just expanding out as 988 rolls out and becomes more known and well known. We're increasing our presence on social media. We've always worked with youth, but we want to figure out new ways of doing it. So as we go on in the next couple of years in this initiative, we're looking to expand out more. Definitely ongoing training with our current contact centers to make sure that, if a youth calls, they have the support, whether or not they're going to any other, if we do have others options, they have resources available for them. And of course, our website, the 988lifeline.org, has resources available to our youth as if they're looking, or those who, youth that they love, that they need support with. We have resources on that website as well. And I'll make sure I provide that as well.
Thank you so much. It is just so great to hear all of the different things that are being done, and that there's new innovation and new ways of collaboration. Organizations are viewing this really for that collective impact to make some change within our communities and within our nation as a whole. So thank you all for the work that you and your organizations are doing there. And as we brought up a few times throughout, what you all have been talking about already is that key piece of early identification and early intervention. And how do we really prepare from that perspective when we're thinking about how we can best serve our youth? And here at MHA, we focus on our before stage 4 philosophy, which refers to treating mental health conditions the same way as we would physical health concerns, focusing on that prevention and early intervention so it doesn't reach that stage 4, which could be, in this case, crisis. So when we're thinking about reducing the risk of youth suicide, how can we increase prevention and early intervention strategies, either within communities, within schools, or within family systems themselves?
For the board, I think the biggest thing for us would be connecting with the tribes and asking them what they feel would work, and also asking youth or asking adults that have lived experience, what age, what grade do you feel like really would have helped, if you learned a few skills earlier on, do you feel that that may have helped you? I don't know exactly what that would look like, of course, because we haven't done it, but thinking about things around coping skills from early ages, doing activities where it's okay to not be number one, to know that just the participation and the effort is just as important as having the correct answer or anything like that, or being the number one team or the VIP player. Like, those are really cool things, but it's absolutely okay to not be that, to not be what perfection or the best athlete. Teaching problem solving skills and help seeking skills from an early age. Help seeking, I think, would be a big one as well. And also how to be a good bystander. So that you may not intervene physically, but how do you intervene by talking to the right people and getting support for your friend that maybe is being bullied, or what are phrases to say that might be helpful versus harmful. These things obviously are, so many things are being taught to young people in school, but what about those life skills that we used to teach, right? Why can't this be part of it? The life skills are how to be a good bystander, how to lead with kindness. Do you have creativity and problem solving skills when something does go awry and you're with your friends and now you're stranded on the side of the road? Does anybody know how to change a tire? I don't know, right? So these are small things, but they can build to really amazing skills to use as you're older. But again, starting with people with lived experience and asking them what could have been helpful and what would be that progression from young ages to older ages as well.
I'm going to jump in. Hopefully I'm unmuted, right? Finally halfway through and I got it. Yeah, and I concur with everything you were saying. Here, we use person-centered practices to learn what is best for individuals and also groups. We listen to the community. And additionally, what we have, as well as trauma-informed care for all of our programs. But what we've done recently is there are so many more parents who lost a loved one to suicide, a child. And rather than us take the lead, those parents that want to be advocates to get the word out and get their stories out, that's far more impactful than Mental Health America Fredericksburg coming in and sharing with those families. And so we have supported and started promoting peer-to-peer networking and listening in terms of trying to move the needle in the community to remove the stigma. And I think that that's an important consideration. And we also have a marketing campaign around Helpline, which is not a crisis helpline. It is 10 years ago, we had a lack of providers to meet the current need. It's not something that's just current in our area. So we developed the helpline. We stay in touch with providers to proactively know who's taking new clients, what insurance they take, and what services they offer. But we have really stuck in our lane. And now when we're going to start marketing the helpline, because the need is so much greater, we have to get the word out that it exists. And that's mental health providers and behavioral health providers we focus in. But we had left out letting general practitioners and family practitioners know about this service. And so we're reaching out to them, developing the marketing materials, but we're having mental health providers, behavioral health or substance abuse, behavioral health providers across the board also help in the messaging to get across to people that focus on physical health that mental health is as important and it's equal to physical health. And that seems to be moving the needle again, using peer-to-peer instead of us always taking the lead in the limelight. And the other thing locally, and I don't know if you guys see this nationally, but there's so many youth programs locally that with the increased need for mental health, their way of addressing that is thinking in terms of mental wellness programs and thinking if I just offer yoga, if I just offer meditation, if I just offer mindfulness, then that will move the needle. And then there's research that shows, not among youth, but with adults, there were no studies with youth, that if the only intervention when somebody is self-harming, have major depression disorder or having suicidal thought ideation or planning a suicide, and the only intervention is something like yoga, meditation, mindfulness, then you're going to have a percentage of that population that you're targeting that actually has increased self-harm, increased depression, increased suicidal thought. Though it's not a large percent, but we still have to be mindful of it. So we started partnering with the programs that are presenting these services to youth to also get the message out that if you are self-harming, if you're having suicide ideation, that you need additional support and to reach out to somebody. And then we provide links to services like Mental Health America's self-assessment tools and information on their website. Those are also excellent. So I'm assuming, Jackie, that you'll post that too as a resource. But that's just some of the stuff we're seeing locally. And we did get reports back from kids that, that they would, and this was most impactful and explained it to me. I'm sitting in a room full of my friends that are telling me that this, yoga is helping them so much, and it's not helping me. I'm still cutting, or I'm still binging, and it's not helping me. They feel more isolated. And so I think we have to be very thoughtful and deliberative about the interventions that we're bringing, and not just chase after the, commonly accepted, ideas, the commercialism of mental wellness, and make sure we're actually being deliberative and presenting stuff that is helpful for everyone.
That was great, Barbara. Thank you. I think what you're saying, what I'm hearing you say that's so important is like, there is mental well-being, right? And yoga is something that can enhance mental well-being, but it is not always key to addressing serious mental illness, right? That would be some of them, a mismatch to addressing serious mental illness. So that's a great point. I think for us at Crisis Text Line, so one of the things that we teach through our training of our volunteers and also put on our website is what we call Always Ask. And this is for anyone. This is for parents, teachers, doctors, anyone can do this, but it's the normalization of how to normalize the questions around self-harm, suicide, death, and dying, right? So, ideally, as a parent, we have conversations when kids are not in crisis about, your mood, your how you're feeling, sharing those feelings, being vulnerable, right? But then it's also teaching us how to ask the questions when you notice behaviors that are atypical. So it's reflecting on the behavior, right? You don't seem like you're like yourself. And then ask the question, are you thinking about death and dying? Are you thinking about self-harm? For people to know that it's not going to cause someone, right? The data has shown you're not going to cause someone to then go out and try to injure themselves or die by suicide, but it actually is easier when someone asks you that question to be able to say yes. And the person asking doesn't have to be a therapist, right? It's about saying that, I am here with you, right? Decreasing that loneliness, that feeling of separation. Let's find help, right? So, I've got Crisis Text Line plugged into my phone, or I have 988 plugged into my phone. Let me call, let's go through this together, right? So it's about empowering the person who's with the person who's not doing well to really support them. I think that loneliness is what that really addresses. The other thing I would say, I love the fact that we're thinking about it like physical health, because we go to see our doctors, for checkups right before school. all kids have to have their school physicals. Well, let's talk about, what are the mental health check-ins or checkups that kids can have before they start school, right? Again, understanding there's a supply and demand issue, there's an access issue, but if somebody is checking in or able to get a child to, talk about some of the anxieties that may exist, you can kind of look at them and help brainstorm before school starts what might be some options to alleviate the anxiety. I think we need to fully support and push for, licensed mental health counselors in schools, not just, school-based guidance counselors, but really social workers and therapists within the school so that they're checking up on these children. And continuing to elevate stories about mental health, right? So continuing to highlight, and we've had an incredible period here where elite athletes have stopped what they're doing and to protect and preserve their mental health, which is something we've never seen before. And they're willing to talk about it, right? So if someone at that level can pause, that's an example that can be used to have the discussion with children and youth so that they know that they're not alone, right? It's really all about saying like everybody has to take care of their mental health. And these are some of the tools that are out there and are available. So I always encourage people to plug 741-741 into their phones so that they can have it accessible when they're with someone and having those conversations.
I have nothing more to add to the richness that's just been spoken on. Just normalizing, having mental distress, it normalize it as if, if you have a headache, you go to a doctor. If you are experiencing these things, it's okay to reach out for help. And amplifying the voices of the lived experience, it's one of the things that makes we use with 988 lived experience is centered because they are the ones that inform how we work with everyone else along with research, but they're the ones that'll tell you this is what worked for me, especially for the youth, because we find that youth will listen to their peers. And if their peers are talking about their experience and what they're doing, and as Barbara said, if everyone's doing yoga and it's not working, how much more powerful is it than, your friend saying, hey, I have a therapist, I do this, I do these types of things. How about we find the support that works for you together? That's just as powerful as if everyone's wearing the same type, if a new pair of Yeezys came out, but hey, this is who I go to get therapy for. How about we talk about BetterHelp? Here's 988, here's the crisis text line. I have them, they've worked for me. How about we call together like Dr. Turner said, and make sure that amplifying that lived experience's voice and making sure that we're providing support where it needs to be support. Yeah, we do need more therapists and mental health professionals available to our youth.
Absolutely. Those are all such great points and really emphasizing that peer support that you all brought up throughout. That is so important. And while we have seen some of this stigma start to go away, we're having more discussions about mental health. They're hearing it more in the news, seeing it more. We're still not seeing those youth getting the services that they need, even if they're having more of those conversations. So while we've made some progress, like Melanie had said, there's still more that we can do to promote those conversations with youth and normalize that it's okay to talk about it in the same way that we would talk about that I sprained my ankle and had to go to the doctor to have it checked out. And so those are just some really great points and things that I think we can all think about moving forward. And really, as adults, how do we model that for youth? If we're encouraging them to do it, how can parents model that in their own homes? And like Dr. Turner brought up, having those check-ins and if you're a parent or you're working in a youth-based organization or you're working in a school, how can we provide those check-ins if we're not able to have providers doing that, we don't have access? all of those are really great points and really great suggestions for our listeners today. One thing that I want to discuss, I know we're getting close to our hour, but there's still so much we can get into with this. We've talked about prevention and the importance of it and the concerns we're seeing. But really, when we're looking at youth behavior and there are those interventions, how do we know when to intervene or when to provide someone with 988 or when to provide someone with the crisis text line number? What are some of those warning signs of suicidality in youth? And how do we know when they need that non-urgent connection to resources versus crisis intervention?
I would go so far as to say that any child at any point can use the non-urgent intervention, right? If we're calling it, mental health is the equivalent of physical health. At any time, right, they should have access to those resources. If we look more specifically, which is what your question is, like, what are we really looking for? Changes in behavior, increased or withdrawal from activities, increased sleepiness, less eating, more eating. But the thing I think we know now is that sometimes there's no warning signs, right, to the crisis, the moment when a child is in crisis. And we see this and we hear the stories where it's like she or he was the most wonderful person, most giving, happy, just spoke to them and they've died by suicide, right? Like, and what that speaks to is there's really a level of functional depression that people can access that is very deceiving, right? So like, which is why it's so important to have those tools available, because death by suicide can be a very impulsive action, right? And in the moment, if you have access to 988, access to 741, or nothing, right, or something to harm yourself, hopefully you're going with your phone, right, and giving that one last opportunity at life, right? But I think it's also important for us to remember and acknowledge that what youth are at risk, right? So our LGBTQ plus youth are at risk. Our BIPOC youth are at risk. Our disabled youth are at risk, right? Period. Like, no questions asked beyond that. And we need to have that level of awareness. And those are specific groups, but I think we can say equally all of our youth are at risk, right? So when is it a crisis? When is it an obvious crisis to you? And when are you taking a child to 911 or calling for immediate services? Is when you're aware, of a plan, a means, how they're going to do it, and a time frame. But we often don't get that, right? It's not that. That's oftentimes an idealized version of the warning signs. But I can't stress enough that parents be tuned in when they hear pieces of that, right? And that's hard for a parent to say, like, and they do. The parents are not my child, or they're just kidding. They wouldn't do that, right? That was that one instance, that one window into what was going on. And if you don't believe it and take action on it immediately, you can miss it. Right. And it's always believing the child. Children don't just wake up, and play around with that type of language or those types of ideations. They are real. And if you have the opportunity that you hear it and you recognize it, as the adults, we have to take action on it.
And I would follow up with what you shared in terms of the action more in immediacy. So, and I wish when we're normalizing conversations, removing stigmas, we would include a mindset or normalizing lock and talk practices, where you're locking up your gun, removing the ammunition from it, particularly if there's any children in the house, you would do that anyway, I would hope, but also your medication. because one study that I was reading, that almost 50% of the suicides that were done using firearm would not have occurred if the person had to wait 15 minutes before they had access to that firearm. Because it's those moments where they've segued into almost a temporary state of where it just happens and they can't stop themselves. So if we can stop access to the means that they would be using, we can prevent a lot of suicides, not just among kids, but across the board. And then when you were talking about normalizing those conversations, I was just reading a report the other day that said that kids between the ages of 3 to 6 that are being treated for depression, and how sad does that seem that kids that young are, but they have an acute sense of what suicide is and death. And then generally, when you want to start talking to your child in those normalized conversations that you had shared about, is 7. The age of 7 is not too early to start having those types of conversations. So, and those are facts that many parents, when I chat with them or talk to them, when we do the orientation and also the signs of suicide prevention, at the schools, but we also talk to the parents. Those two things are the disconnect that seems to be there most often. So.
I would just like to quickly add that the things that we're seeing on social media and making sure that youth, if they don't feel like they can talk to their friend about something concerning on social media, that they bring that to an adult. So also educating youth to say, it's okay, we will keep it private. We won't tell them why we know. We can see it on their social media, so we can just say, I saw this and it made me concerned. So a little plug too for the Northwest Portland Area Indian Health Board. We actually have a responding to concerning posts on social media webinar that is offered on the healthynativeyouth.org website, all one word together, Healthy Native Youth. And it's just a way to bring up those conversations because social media is a place that we're seeing a lot of different emojis, different language used than the person when they're using it in real life. It might sound different, look different, and they're doing a really good job hiding it verbally if you're right next to them or right across from them in the car or whatever. But on social media, there might be something a little bit different. So just being attuned to those things, paying attention to them, being connected to their families and their friends, so that if somebody sees something, they feel comfortable coming to you, or going to another trusted adult and talking to them about it. And, reminding our youth that it's okay, like we've all said, it's okay to not be doing well. And people, and hopefully adults, are asking you, you're just acting a little different, which is no problem, but I wanted to know, is there something deeper? If I lost my scholarship, or if I am no longer playing first base and that's what I would be upset about it too. Can you tell me more about that? Just starting really basic conversations and making it normal so that it decreases also that stigma about talking about your feelings and talking about when you're let down, and how far does that let down go? Is it turning into a depression? Were you already there? And just making those things normal, those check-ins. I'm sure there's always so many approaches that you have to do at one time. And so we're throwing so many things at people today, but, just as adding a little bit here, a little bit there, I feel like is something that we can all do, every couple of weeks or months, you add another piece to what we're already doing.
Absolutely. I know we're right at the hour, but any final thoughts on that from anyone? Wonderful. Well, thank you all. I know we could probably go on for another hour and have so much to discuss, but I want to make sure we respect everyone's time. Thank you all to our speakers. Thank you all to everyone who tuned in. I know there were some wonderful questions and we didn't get to all of them, but a lot of the topics of questions that I saw coming up are addressed in some of the materials that were mentioned today and also in some upcoming webinars that we'll be having pretty soon here in September, October, and November. So stay tuned for all of that information. Just a reminder, I know that Dr. Turner and Colby and we've mentioned many resources today and different things. We will make sure those are included in your follow-up email. And I'm also going to put in the chat right now the link to our kit at MHA that was released at the beginning of the month and dives into what parents, teachers, supportive adults can do for youth mental health in this transition time back to school and throughout the year, and also for youth themselves. So that's another resource you can utilize. Again, we'll be including all of that in the follow-up. So just thank you all to our speakers for your expertise and your knowledge and vulnerability sharing with everyone today. And thank you all to our viewers attending. Have a wonderful rest of your afternoon. Thank you.